'tis the season with many reasons to smile. But what if your teeth aren't as white as snow? Dentist Steve Marsh is here with a flurry of ideas for keeping your smile bright, even if your teeth have troubles. So welcome back to the show.
Thanks for having me, Lori.
Now, we're not just talking about whitening, correct?
Right. Well, we've talked about Zoom whitening, which is what we do in the office. It takes about an hour and a half, and that's for people who may have a party and they want to get it done quickly.
Okay.
But even with that, you need to maintain the whiteness. So we have in our office, we will generally make, these are whitening trays, and they look almost like a mouth guard that a ball player wears. And then in the tray, we put a gel. The gel is this material here. It's carbamide peroxide, not that the viewers need to know that, but it's put in, and if you wear it for about a half hour every 2 weeks or so, you'll be able to maintain the color. Or if you just want to do it gradually, this is a nice way to do it gradually.
All right. And we don't see silver in our mouths anymore so much. It's more white.
It's funny. We haven't used silver in our office for over 15 years. You know, there's environmental problems, there's mercury problems, and the other thing is they do is over time they crack teeth. And of course, no one likes to see a tooth that has a silver filling. Right. So what we do in our office is we clean out the old filling. This is a patient who came into me. It wasn't very big, but you can even, if you look very closely on the before, there's a crack line on the tooth. So when we do it, we numb up the patient, make it very comfortable, take out the old filling. We then replace it very conservatively with a tooth color filling. So it does two things. Certainly it looks better, Lori. The other thing it does is this material bonds on. It's a composite. We have all different colors, and that also helps hold the tooth together. So there are many advantages to composite fillings versus the old silver fillings that many of the viewers have had.
And you can fix chips too.
Yeah, so here's a patient who came to me actually before a holiday party last year, and he said, I need to get it looking better and I want to do it quickly. He's also out of town a lot, he's on the road. So what we did in the upper teeth is we just reshaped them, Lori, and then use that same bonding material that we use in the back. There's some that are more polishable and more aesthetic in the front. We did that on the upper fronts. And on the lowers, what we were able to do, Lori, is just with some reshaping, we took those teeth down to a little bit more normal appearance. He had a tooth that was way behind the others. That happens sometimes. Sometimes nature doesn't get it perfect. And if you don't have time for orthodontics, we're able to do it that way.
All right. Many people do whiten their teeth, though, as we've discussed. And what if, though, some people left their teeth a little bit on the darker side? Are they out of luck with these kind of compounds and new treatments?
You know, it's funny you ask that question. I brought this model that we have in our office. These are colors that we used to use. These are colors of porcelain. And in the old days, you can see they were pretty yellow, silver, gray, not so silver, but many different colors. Well, today we have much, much whiter types of porcelain. So when somebody has a tooth that's dark, and sometimes they don't respond well to whitening, and even bonding sometimes will work. We also use porcelain to give them a beautiful smile and a brighter smile.
Okay, and you've got some pictures to prove it, don't you?
Of course we do. So this is interesting because it's a mother of a very close friend of mine. I knew him in dental school. He was in medical school. She's 85 years old. She said she's always hated the way the teeth looked, and she wanted to do it quickly, and I said, give me about an hour and a half, and we went with, she said, give me the whitest you have. We used white composite. We did that by hand, not porcelain. Maybe an hour and a half, we got her done. She loves them and says everywhere she goes, she gets compliments.
That's great.
One of the other issues you have is darkening teeth over time, and we also talked about how as we get older and mature, the teeth tend to spread a little bit. We use porcelain veneers. There are no braces. Reshape the teeth and put on a beautiful porcelain veneer on this patient, and she speaks in front of a lot of people and love the result. And here's sort of a combination, sort of pulling it all together, Lori. This patient showed a lot of gum tissue. She didn't like the color. She didn't like the shape. We used a laser to bring up the tissue to give her that much more natural smile, and then put 6 porcelain veneers on the front and some crowns on the back, and really brought it all together. And in the lower front, we did a little bonding with some bonding materials. So you can even mix and match materials to get that beautiful smile.
And they were impressive.
Thank you.
If your smile welcomes whitening, you can boost the brightness of your teeth no matter what treatment you seek. Here's a bright idea. Give Dr. Marsh a call for help. The number's coming up next.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com.